There's a quiet kind of fear many of us carry as we get older. It's not the fear of wrinkles or gray hair. It's the fear of something hidden, something growing inside without our knowing. Imagine walking through your day, feeling mostly fine, maybe just a little tired or sore, and not realizing that your kidneys, those small but mighty filters working day and night, might be under siege. The truth is, kidney cancer often whispers instead of shouts, and that whisper can be easy to miss until it's too late. I'm Dr. Brian, and welcome to Channel Vital Science for Seniors. I've spent decades caring for older adults, and one lesson I've learned is this: when the body speaks, even softly, we must listen. Today, we'll uncover 8 warning signs of kidney cancer that are too often brushed aside. Some may surprise you, others may even sound familiar. Let's start with the first set of warning signs, the ones that show up close to where the kidneys sit, deep inside your back. The kidneys are like two diligent custodians tucked just below your ribs. Day in and day out, they filter the blood, remove waste, and balance fluids. But when something begins to go wrong there, when a tumor starts growing, the body sends signals. They're not always loud, but they're important. The most common whisper is blood in the urine. For some, it's just a faint pinkish tint. For others, it might look rusty or even deep red. Many people assume it's from a bladder infection, kidney stones, or even something they ate. I once had a patient, Mr. Ellis, a retired teacher in his early 70s. He noticed his urine looked a little darker one week, then back to normal the next. He told himself it was probably nothing, but a few months later it came back, and by then the tumor in his kidney had grown large enough to block normal flow. We caught it in time for surgery, but he admitted to me, "I wish I hadn't waited." That's the danger with hematuria, blood in the urine. It comes and goes, but every single episode is worth checking. Research from the Journal of Urology confirms that up to 20% of visible blood in urine cases in adults over 50 are linked to serious conditions like kidney or bladder cancer. That's not a statistic we can afford to ignore. Another signal is back pain or pressure, but not the kind you get after gardening or lifting a heavy box. This pain is deeper, more internal, often one-sided and stubborn. People sometimes describe it as a dull ache that doesn't quite match up with muscle strain. As a physician, when a patient over 50 tells me they've had unexplained back pain lingering for weeks, especially near the flanks under the ribs, I think about the kidneys. Tumors can press against surrounding tissues or block the flow of urine, causing a pressure that radiates through the back and sometimes into the abdomen. It's easy to dismiss as just getting older. But when pain persists without a clear reason, that's the body waving a red flag. And then there are lumps or masses. These can be tricky because they are not always easy to feel. But sometimes a person or their doctor will notice a firm bump in the side or lower back. A patient of mine, Mrs. Daniels, came in for her annual checkup. She was feeling well, but mentioned almost casually that she'd noticed a little fullness on her right side when lying down. On examination, I felt a firm, irregular shape near her kidney. Imaging later confirmed a tumor. Because she caught it early, her treatment went smoothly. That's the power of paying attention. What's challenging about these early urinary and back symptoms is how ordinary they seem. Blood in urine might only show up once. Pain could be brushed off as arthritis. A lump might be hidden. But behind these small signs can be a disease that, if caught early, is often treatable. The kidneys are quiet organs. They don't complain until something is truly wrong. Listening carefully and acting quickly can make all the difference. Now let's shift from the kidneys themselves to the ripple effects they create throughout the body. When the kidneys struggle, it doesn't just stay local. Because they're so central to our circulation and fluid balance, trouble here can spill over into swelling, blood pressure changes, and even the way our blood carries oxygen. Think first about swelling in the ankles and legs. Many of my older patients have experienced this, and often the first thought is, it must be my heart, or maybe it's from sitting too long. Those are fair possibilities, but kidneys play just as big a role. Normally, they act like careful regulators, draining excess fluid into urine and keeping your body from waterlogging itself. When a tumor interrupts their work, the body's plumbing goes awry. Instead of draining, fluid leaks out into the soft tissues of the ankles and calves, making them feel heavy, tight, and sometimes even leaving a sock mark that lingers long after the sock comes off. I remember Mr. Alvarez, a grandfather who came to me complaining that his shoes didn't fit as well anymore because his feet seemed puffier by the evening. He thought it was just part of aging. When we ran tests, we found that his kidney function was impaired, and further imaging revealed a small tumor. What struck him most was how such a small organ could affect something as distant as his ankles. But that's the nature of kidneys. They're like behind-the-scenes managers. When they falter, the whole system feels it. Blood pressure tells another story. The kidneys don't just filter fluid, they also act like master controllers of circulation, releasing hormones such as renin that tighten blood vessels to raise blood pressure when needed. But when cancer or other disease affects the kidneys, this delicate system can spiral out of control. The result is persistently high blood pressure that doesn't respond well to the usual low-salt diet or medications. Imagine your kidneys as traffic cops who suddenly wave everyone forward all at once, causing a jam in the arteries. That's what excess renin does. It makes the vessels clamp down, pushing pressure higher and higher. One of my patients, a retired nurse named Evelyn, came in frustrated that her blood pressure remained sky high, despite 3 different medications. She was meticulous about her diet, low sodium, lots of vegetables, yet nothing seemed to work. Only after a deeper look did we discover a tumor on her kidney that was overproducing signals to raise blood pressure. Removing it brought her readings back under control, and for her it felt like a liberation. Then comes anemia, a quieter but equally draining symptom. Healthy kidneys produce a hormone called erythropoietin, which tells the bone marrow to make red blood cells. These cells are the little couriers carrying oxygen to every tissue. When a kidney tumor interrupts this signal, production slows, and the blood thins of its oxygen-rich carriers. The result? Anemia. People often feel tired, pale, or short of breath, even when climbing just a short flight of stairs. Some describe it as feeling like their get up and go has gone. Science backs this up. A study in the Lancet Oncology showed that patients with kidney cancer frequently present with anemia before diagnosis, sometimes months earlier. It's not the kind of symptom that screams cancer, but in the context of other changes, swelling, high blood pressure, it can complete the picture. These circulatory and fluid-related signs may not sound like kidney problems at first. Puffy ankles, stubborn hypertension, feeling winded. They're easy to attribute to aging, weight, or heart concerns. But when the kidneys are the hidden culprit, recognizing these patterns early can give someone the gift of timely intervention. One of the most heartbreaking parts of my work is seeing how kidney cancer can quietly rob people of their vitality long before they know what's happening. This is where the story shifts from obvious physical signs like blood in the urine to subtler whole-body changes, energy that fades, appetite that disappears, and weight that seems to slip away without permission. Fatigue is one of the most common complaints I hear from patients over 50. They often chalk it up to age, stress, or not sleeping well. But fatigue from kidney cancer feels different. It's not the kind of tiredness that a nap can fix. It's a deep, dragging exhaustion that lingers no matter how much rest you get. Imagine your body as a city. Normally, red blood cells are like delivery trucks, carrying oxygen to every neighborhood. When the kidneys fail to send out enough signals to make these trucks, because of a tumor interfering with erythropoietin, entire neighborhoods go undersupplied. The result is a city running on empty. Lights dimmed, productivity stalled. That's how fatigue from kidney cancer feels. The whole system running on less fuel. I recall a patient named Carol, a retired librarian. She came to me saying she was too tired to play with her grandchildren. She blamed herself, thinking she wasn't exercising enough. But her blood work showed anemia, and further scans uncovered kidney cancer. When she finally got treatment and her energy began to return, she told me the hardest part was realizing she had silently accepted exhaustion as just aging. That's a trap many fall into. Loss of appetite and unexplained weight loss are also major signs. Cancer is sneaky. It doesn't just grow, it consumes. Tumors pull nutrients and energy from the body, almost like a parasite feeding off its host. Patients often tell me that food simply doesn't taste the same anymore. Some even lose their natural signals for hunger. A piece of toast that once felt comforting might suddenly seem unappealing, and portion sizes shrink without effort. Over time, the pounds slip away. I once treated a gentleman named Richard who had lost nearly 20 pounds in 6 months without trying. His wife thought it was wonderful at first. He's finally slimming down, she said. But the reality was more serious. His cancer was using up glucose and nutrients, leaving him depleted. Once we treated the cancer, his appetite and weight slowly came back. Though it was a tough road, research supports this pattern. A study in cancer epidemiology found that unintended weight loss is one of the most common early systemic signs of kidney cancer. It doesn't always come with pain or obvious local symptoms. Sometimes it's the body's way of waving a silent white flag, telling us something deeper is wrong. What makes these symptoms especially dangerous is how easy they are to dismiss. Fatigue, everyone feels it. Loss of appetite, maybe stress. Weight loss, maybe you needed it. But when these changes are persistent, unexplained, and especially when they happen together, they can point to a hidden cancer draining the body's reserves. The hopeful side is that once identified, many patients recover much of what they lost. Energy returns, appetite comes back, and weight stabilizes. I've seen it happen many times. That's why I tell my patients, never accept profound fatigue or sudden weight loss as just aging. It could be your body's most important message. Now let's turn to the final signals, the ones that often emerge when kidney cancer has been brewing for a while and starts to disturb the body's internal thermostat. I'm talking about fevers and night sweats, symptoms that sound more like an infection than a tumor, but in truth, they can be powerful clues. When cancer cells grow, they don't just sit quietly. They release substances that confuse and inflame the immune system. One outcome is a condition called paraneoplastic syndrome, where the body reacts as if fighting off a chronic infection. The result? Persistent low-grade fevers that come and go without explanation. Unlike the sharp spike of a flu fever, this one simmers, hovering just above 38 degrees Celsius. It can drag on for weeks or months, leaving people weary and puzzled. Night sweats often follow the same mysterious pattern. Patients tell me they wake up drenched, their pajamas soaked, sheets clinging as if they'd run a marathon in their sleep. One woman I treated, a vibrant 68-year-old named Margaret, said she had to keep extra sets of pajamas by the bed because she sometimes changed twice a night. At first, she thought it was menopause returning, decades late, but tests revealed advanced kidney cancer was the real culprit. These immune-driven symptoms are cruel because they masquerade as ordinary conditions, hormonal changes, infections, even stress. Yet when they persist, especially alongside the other signs we've discussed, they demand attention. Research published in the British Journal of Cancer notes that fever and night sweats, though less common than blood in the urine, are frequently linked with advanced cases. That means when they show up, the disease may already be pressing its advantage. Still, there is hope. I've walked with many patients who caught these symptoms early enough to act. Margaret, after surgery and targeted therapy, is still with us years later, walking daily and volunteering at her local library. She says those night sweats saved her life because without them, she never would have gone to her doctor. So while fevers and night sweats may feel like nuisances, they can be life-saving alarms. When your body feels like it's burning up from the inside for no clear reason, or when you're waking drenched despite a cool room, it's time to listen. These symptoms may whisper of something deeper, and catching that whisper could change everything. So here's what I want you to remember. Your body is wiser than we often give it credit for. Blood in the urine, back pain, swelling, fatigue, night sweats, none of these should be brushed aside as just age or stress. They are signals, and signals are meant to be answered. If you've noticed any of these changes, speak to your doctor without delay. Early detection can make the difference between a difficult battle and a hopeful recovery. Stay hydrated, nourish yourself with wholesome foods, rest well, and trust that at any age your health is worth fighting for.